Brazil continues the fight against the disease, that Brazil links the efforts at federal and at state level in a much more systematic way, that there is a focus on a comprehensive approach to controlling the disease and doing that in a sustained fashion. It is easy, obviously, to criticise any individual country, and no country, no organisation is without criticism or without fault or without difficulty in this response. Again, today's message is not about what happened last week, last month, or the last 3 months. And when the Director General talks about politicisation as well, we all need to recognise that in many countries, the government is the government of the day, and we need to find a way for each government to find a way forward, for each government to serve its citizenry, for each government to serve its people. And we need to encourage and support governments in doing that. We need to find all of government, all of society approaches. And when we talk about avoiding politicisation of the virus, that cuts both ways. And we may, in many situations, as individuals in society, have to provide encouragement and support for a government that may not be of our choosing or liking. And that is the difficulty and the challenge of national unity against a common enemy. When you choose national unity against a common enemy, you sometimes don't get to choose who leads you in that fight. And you have to find a way. You have to find a way to be able to take that forward. And that's the challenge for all countries now. And I would just say from my personal perspective that we cannot continue to allow the fight against this virus to become and be sustained as an ideologic fight. It cannot be. We cannot beat this virus with ideologies. We simply cannot. And I think everybody now needs to take a step back at 6 months. Everyone, every individual needs to look in the mirror and say, am I doing enough? And every politician needs to look in the mirror and say, am I doing enough to stop this virus? And I think we need to have a big conversation with ourselves on this. And now is the time, because we don't have time to waste.
If I just may briefly add, it has nothing to do with the politics, but it's about the science. And I would like to ask us to side on the side of science, and to side on the side of public health and experience. We are learning from experience. We are learning about this virus. We know what works. We're not saying that it's easy. We're not saying that it will not take more time, and it will be difficult for individuals and families and communities and nations. But we are adapting our approach and tailoring our approach based on what we are learning. And we need people to be with us with this science as we communicate this with you, as we adapt it within our guidance, as we modify these approaches going forward. We know what works in suppressing transmission, and we know what works for reducing mortality. Let's do that.
This will conclude a longer than usual press briefing. Still, we will have an audio file sent to you soon, and the transcript will be posted tomorrow. From my side, I wish you a very nice evening.
Thank you. Thank you, Tariq, and thank you all for